Let's get started. So, good evening, everyone, and thank you for joining us for tonight's program. My name is Melissa Hong. I graduated in '99, and I'm also the chair of the Tufts Asian American Alumni Association. It is my pleasure to welcome you to this evening's conversation with Dr. Monica Wang, author of The Collective Cure. Monica is an associate professor at Boston University School of Public Health, adjunct associate professor at Harvard T.H. Chan School of Public Health, and a proud jumbo of the class of 2007. Our MC this evening is Dr. MyDzung Chu, assistant professor in the departments of medicine and public health and community medicine at Tufts University School of Medicine. MyDzung is also the director of ADAPT Coalition, where she works to advance the health and well-being of underserved communities in Boston's greater Chinatown. Over the next hour, Monica and MyDzung will explore the ideas behind the collective cure and what it means to build healthier communities together. Thank you both for being here with us tonight. And MyDzung, I will turn it over to you.
Wonderful. Monica, what a treat to be in conversation with you tonight. First, congratulations on your incredible book. I think you touched on everything that we need to know about both upstream and downstream solutions for public health. I really appreciate it. And also, as a working mom, a professor wearing many hats, a community engaged scholar, I love how you wove your personal story into each of the chapter, and I really appreciate that in your work. So shall we get started and learn more about the book?
Yes, let's get started.
Okay, awesome. So you opened the book, Collective Cure, by describing your childhood growing up in Boston and as the daughter of immigrants. You also participated in the METCO program. You call that experience a tale of two neighborhoods. What did seeing those two worlds teach you about how health is shaped?
Yes, great question. So, for those of you in the audience who haven't dug into the book, this is one of my favorite stories to tell. So, both my parents immigrated to the US from Wuhan, China, and they both came from food insecure households. And my dad, growing up, really excelled in the English language. And in college, a visiting professor from Boston University recognized his talent and he encouraged him to apply for a PhD program. And my dad applied and got a full scholarship and a very modest stipend. And I think without that support, he wouldn't have been able to have that experience. So off to Boston he went and he was able to complete his PhD and pursue, a job in academia. And so growing up, the common theme was, education is the great equalizer and, really focus on education as the pathway to greater economic stability and financial success. And for many immigrant parents who come from instability, stability is the flex. And we lived in Jamaica Plain and Roslindale. And my parents couldn't afford private school, but what they did do is look for the best public schools available. And they stumbled across a program called METCO. And for people who aren't familiar with Boston's history, METCO is one of the country's longest voluntary school desegregation programs. So it's a busing program. It allows students who are of color or from economically disadvantaged backgrounds who live in Boston and allows them to bus to public school districts in other suburban areas. And so from elementary through high school, I lived in Rosendale and I bused to Belmont. And even though they were only 10 miles apart, they looked like completely different worlds. So growing up in Rosendale, I lived in rent-controlled housing, and we lived by Washington Street, which is a major artery. So there was a lot of vehicle exhaust from buses and from cars going back and forth. There weren't a whole lot of, grocery stores, but there were fast food places. So we lived right by a Burger King, lots of corner stores, lots of liquor stores. Even though I lived really close to a park, we knew not to go there during certain hours of the day or at night because it wasn't always safe. And so, even though we may have had access to some sidewalks and parks, it didn't mean that we always had safe opportunities to be active outside. And then in Belmont, the houses and neighborhood look completely different. So one of the first things I noticed is that there were a lot more trees. And with trees, it provides canopy and shade. The air is fresher. The houses are spaced a bit more far apart, so there's a bit more room for people to move about. And a lot of my peers there walked or biked to school. They had healthy school food lunches and they participated in after school arts and sports programs. And some of them got brand new cars for their 16th birthday. So it was economically different, it was environmentally different. And then I also noticed it was very different health-wise. So my peers who lived in Boston and my Metco peers, a lot of them growing up struggled with chronic diseases like asthma or diabetes. And I didn't necessarily see my Belmont school classmates struggle with the same health issues. And so that was my first experience of really spending substantial time in two very different neighborhoods. And when I was younger, I thought, I'm commuting. But when I went through undergrad and grad school and started learning about the policies and the history of housing and structural segregation, I realized I was actually moving between opportunity. And so that was one of the major drivers for why I was interested in understanding community health and also figuring out how can we create communities to be healthier to begin with.
Yeah, thanks for sharing that history and that story and just the visceral experience you had every day of commuting to two very different neighborhoods. I want you to expand on more your upbringings, right? The beautiful story, an example that your parents have provided, and specifically your dad in his own pursuit here in the US. So, looking back, is it an example of how your experience at Tufts, your undergrad education here, has really influenced the direction of your career today?
Yes, absolutely. And I remember the exact moment it happened. So, I was interested in health, and before I came across community health, which is one of my double majors at Tufts, I was on the pre-med track. So by sophomore year, I had already taken, bio and taken chem. So I had half of my pre-med requirements finished. And that was great with my parents because that was something they understood. You go to school, you're pre-med and you become a doctor, or you go to school and then you go to law school and you become a lawyer. It's a very linear trajectory of a career that they could understand. And I took Intro to Community Health with Edith Ballback. And one day there's a professor named Christina Economos who came. And many of you may be familiar with her now because she's dean of the School of Nutrition. And she talked about her work in Shape Up Somerville. And even in, this must have been 2005, even in 2005, they had already had promising results. And that was the first time I saw and heard about clear-cut examples of strategies where people were not focused on individual education or changing individual behavior, but rather to prevent childhood obesity, they really focused on changing the environment and the community. So they talked about changing the school food lunch options, changing what was available and where things were placed so students would want to reach for the healthy foods. They talked about walking school buses and working with the school community, like the restaurants, to change the menus that were available in Somerville. And over the course of the year, they found very positive results in terms of preventing childhood obesity. And I thought, this is what I want to do. I want to move from working one-on-one with individuals to working with communities and thinking about how we're structuring environments so that it's easier for people to be healthy. And that's when I decided I want to double major in community health and child development. And I want to pursue a career in public health and not medicine. And my parents weren't thrilled about that. They didn't know what public health was. They tried to talk me out of it. And they said, if this is the path you want to go, what's the career and what would your jobs look like? And that's when I started doing research into the different degree programs. And I was very determined. So I was able to forge my path, got my master's and my doctoral degree. And so my parents, they haven't complained since.
Yeah, that's a wonderful story and also very inspirational, your career journey and Dr. Economos and other faculty at Tufts that really shaped your experience and
Mhm.
being in the community. I read about that study recently, Shape Up Somerville, and just so
Mhm.
impressed by all the different layers. And in the work that you adopt in your own work as well in the book, you talk about all of it, right? Both upstream and downstream. And so when oftentimes when we think about health, especially during crises like COVID, right, we think of frontline folks like doctors, medications, hospitals, right? Those are very like where we get, where we get treated when we're sick. But in your book, you argue that health is often shaped by places, our environments, where we live, where we work, where we grow up, where we pray and play. Can you share more concrete examples of that and that could help people see how place really is embedded in our health in our everyday life?
Yes. So when I was um, working for the CDC as a consultant one summer, I was helping them evaluate a large-scale national initiative called the Green and Healthy Homes Initiative. And that particular initiative was focused on how there were multiple factors contributing to different outcomes. So housing is related to health. So if we have healthy housing, for example, different kinds of exposures in the environment, if you have safe stairs, if there's lead exposure, that could be damaging to children's health. And one of the families who lived in Baltimore, there was an 8-year-old son who kept winding up in the ER. So in one year, he went to the ER 8 times because of asthma attacks and once for pneumonia. And the family had health insurance. And you can have the best asthma medication that money and insurance can offer, but the triggers and the actual root cause were the environmental triggers in the home and in the community. And so you can keep repeating that cycle, but what actually was needed was a complete remediation of the household infrastructure. So the house was old. There were a lot of different ways that it could be improved to improve the indoor air quality, adding different kinds of filters. And the family applied and qualified for housing assistance to receive that because not only did it lead to poor health outcomes, because of older homes, it also led to draft issues. So electricity bills were high, gas bills were high, and because the 8-year-old missed a lot of school, his mom missed a lot of work. And so all of these factors are really interrelated. And so moving beyond just medication, what's the root cause of the issue? And can we work collaboratively with different kinds of sectors to address it so that we can avoid different kinds of problems from repeating themselves? Because if they're predictable, then they're preventable.
Yeah, and this brings me back to literally the first paragraph of your book where you were in that classroom. You were a new professor teaching to, mid-career clinicians about social determinants of health. I know this is a little bit off, but can you just give me that sense
Yeah.
of, and then at the last chapter of your book, you talked about the revelations that many of your students had and how they were integrating social determinants of health. So can you kind of give us a little snippet of that and how
Yeah.
working directly with doctors and clinicians about the places where we live and work. What were some of the kind of highlights from that experience
Mhm.
teaching clinicians?
Yes, I'm so glad you brought this up. So I have to set the scene a little bit. So I was a postdoctoral fellow in 2013. So I had already graduated from Harvard with my doctoral degree. I was doing a fellowship, and I had taught graduate students before. And one of the professors at Harvard was the co-founding director of a program called the Masters in Healthcare Management. And it's essentially an MBA for mid-career physicians who are looking to gain more leadership skills. They're taking courses in finance and accounting, in communications, in leadership, in negotiations. And that was the year where they wanted to require a course on social determinants of health. Because if you're leading healthcare organizations, social determinants or social drivers is very much embedded into population healthcare. And so I was 28 at the time, and the average age of students in that program is 48. And it ranges between, somewhere in the 30s to all the way in the 50s or 60s. So these are not your typical grad students. And when I walked in, I could immediately tell that there was some high skepticism there of who is this person who looks much younger standing in front of us. And I was not an MD. I was not a tall, white, older person. And I wasn't teaching them about management. I was teaching them about social determinants and in a hybrid format. And in 2013, hybrid was very much new at the time. So let's just say that they weren't highly enthusiastic when I first talked to them and introduced them to the course because many of them were wondering, how is this relevant to my work as a leader? I'm here to learn about financial, reports and how to run a company as a CEO. But by the end of the course, I could slowly see that their enthusiasm, their engagement for the materials really come to life because usually when I say social determinants or somebody else hears that word, they usually think immediately of um, uninsured populations, low-income populations. They might think, communities of color, but they're not thinking themselves. And the reality is that social determinants are a very comprehensive list of pretty much everything that's not related to genetics or lifestyle that can influence your health. And that includes how stressful your job is or how your work environment is designed. It includes our social relationships and social connections and social isolation. And, everybody has different kinds of neighborhood and environmental exposures. And none of us could control the environments we lived in growing up. And through a combination of research and articles and cases, little by little, they started to realize that, the social drivers of health really impact everybody. And so, how do we meet people where they are so that it's not continuing to solve the same issue of a patient showing up with asthma attacks or, elevated blood lead levels or growing rates of cholesterol or diabetes or cancer, but rather what's going on at the community level so that we can also better understand where patients are and connect with other organizations, nonprofits, local policymakers, so we're not tackling at this as a siloed issue. The other aspect that, and by the way, I still teach that course today. So I started with cohort 14 and I'm about to meet cohort 28 this summer. And so the course is still going on. I've taught over 400 of these physician leaders. And year after year, they truly appreciate the newer framework and understanding. And I would say they taught me something as well. So in grad school in public health, there's a narrative around, medical schools and healthcare providers really focused on downstream and how they really need to also consider upstream. And while I agree with that, I also think it's a bit unfair and unrealistic to expect healthcare to also address housing, cost of food, jobs, the environment, because it's not what they're trained for, and they don't have leverage necessarily across all of those other sectors that impact health. Rather, I think the goal of the course and the goal of this book and this work is helping people recognize all of these factors that influence health and recognize the slice that they have in terms of contributing to making healthier communities. And so for a lot of physician leaders, it's not I have to see a patient in under 10 minutes and, diagnose them and make sure that they can, be stable and figure out housing or broadband access and domestic violence and loneliness and isolation, which becomes too much. It's rather, I have a better understanding of how all of these factors may be influencing how this patient is showing up here. I can have a more comprehensive and holistic conversation rather than immediately moving to judgment that a patient is being non-compliant, but rather understanding what are the other things going on in their lives that might be impacting their health behaviors or their health patterns. And at the leadership level, it's understanding what are the patterns that this health system is seeing again and again and again, that we could work with other people in our communities, with other local leaders, with other business owners, with other community members to find new ways of collaborating so that we each bring something to the table rather than asking healthcare to solve everything.
Yeah, thank you so much for showing that. Like we each have a role. And one of the chapters that I found myself just like, I was like glued to was around the chapter about do you see me, right? Especially during COVID. And you wove a lot of your personal stories about like your spouse was also in residency at that time. You had two young kids. You were wearing many hats as a working mom, as a professor. And so, you mentioned job stress, and that scene where after you dropped off the kids and you're come back and Leo just destroyed something in your house, you're just like, all you just like lay there for a second. And I could relate to that so much. It's just a lot, right? And so, can you share more about how job stress really impacts your own health, as someone who wears so many hats? So how does our jobs and daily pressures show up physically, manifest physically in our body?
Yes. So it manifests physically and mentally. And there's a couple different ways we could assess job stress. So one is how much flexibility do I have over my daily schedule, my day to day? So, for example, 12-hour shift workers, it's a very inflexible schedule in terms of if I have to show up at a hospital as a healthcare provider from, 11 to 7, there's no wiggle room. Versus someone in academia, there's a lot more flexibility in how my day is scheduled. Yes, there's meetings and teaching, but there can also be a lot of times where I'm the director of my own schedule. And that allows for work-life balance. Like, can I actually take time off to make a dentist appointment and see my healthcare provider once a year and get my screenings? Do I actually have time to exercise or get movement in or cook, a home cooked meal from scratch so that I'm not eating as much ultra processed food or takeout food? And when jobs are highly inflexible and they're also highly demanding, so they could be emotionally demanding and physically demanding. And so, if a job is, for example, you work in the ER, that's very emotionally demanding. If you work as a firefighter or construction worker, that can be very physically demanding. And if you have a very high demand job, but low control, low flexibility, you have low autonomy, that can lead to prolonged stress, which leads to increased rates of anxiety, depression. It can also manifest in chronic conditions like elevated blood pressure, which can lead to different kinds of heart disease. And it can also manifest in your immune system. So you are sicker more often. So you're more prone to get infectious diseases if you're not able to sleep as well, your immune system's weakened. You can also have inflammation in different ways. So for me, whenever I am experiencing chronic stress that doesn't go away, it shows up for me as eczema. And so that's one of the things that I learned the hard way in terms of job stress because I tried for over a year to go to see a dermatologist to address my eczema flare up. And it was very strange. I never had it before. And we tried different kinds of creams. I went back twice. It wasn't helping. And I changed all my detergents. I changed my lotion. And my dermatologist said, are you stressed? And I said, yes, I'm in a particularly demanding time in my life. There's one specific aspect of my role right now that's very stressful. And the dermatologist said, stress less. And I said, thank you, but I waited months for this appointment. Is there something else you can tell me? But it was a wake-up call that, I had been feeling there was a particular academic administrative role I was wearing that I had been doing for a couple years and it wasn't panning out. And it was a bit of a jump start for me to really reevaluate how do I want to be spending my time. And so I Took a few weeks, but I decided to make an exit strategy. So I wrote up my resignation letter from that specific role. And within 1 month, I could feel my nervous system start, regulating itself. By month two, my rash had started to go away, and by month three, it was completely gone. And so it was a very physical reminder to me that your body keeps score, and the ways in which, we spend a third of our lives at work. And so that makes a huge difference in terms of how we are internalizing whether our environments are healthy for us or not.
Well, kudos to you. I think that you're just sharing with us in a few minutes, but I'm sure that took months and maybe like years to figure out, diagnose, and take those steps. So just kudos to you for being so proactive. And congrats on making that decision. So one of the opportunities to address stress and reduce stress is through community and relationships. A lot of the work that we're doing in Boston Chinatown is building community with our community partners. And so one of the so not too surprising, but really profound insight in your work is the power of relationship for our health. You talked about it with Dorothy and our community, right? And helping to increase vaccine, Maricela and her weak ties in her community in New York. Can you elaborate more on why relationships are so important for our well-being?
Yes. And so this is something I like to bring up whenever people talk about, biohacking. And I could say you could be a billionaire in biohacking, but if you are lonely and isolated, you are not going to have a long, healthy lifespan because we as humans are wired to be socially connected to one another. And so um, people tend to view social relationships as maybe, secondary or an add-on, but there's so many ways that it can help us live healthy lives, both physiologically, mentally, and then also socially. So we tend to see this most visibly during times of crises, but it also happens during the everyday moments. So during crises like hurricanes or pandemics or wildfires, when there are actual life and death situations going on, if you have a network of people who can help you in different ways, whether that's information. So if there's a pandemic, do I know where to get a vaccine? Do I know what I'm supposed to do to keep myself safe? Or a wildfire, do I know it's coming? Do I have access to broadband? Do I have people whom I can stay with if, my house is in danger? Um, if, my house burns down financially, is there someone I can lean on so I can start over? These are all very different kinds of tangible ways in which, if we have close networks that also give us different kinds of social financial capital, it helps us weather storms. And we see people who are isolated or who live alone. For example, many people who pass during heat waves are elderly people who live by themselves. And so that's a very visible example of how, when you're socially connected, when people know you and they can check on you, and you live in a place where people have high social cohesion. So they're willing to help each other out. You know each other well enough that you're willing to, help someone shovel or to offer them to, have an ice cold drink if it's a really hot day. That can make a really big difference in terms of weathering these storms. And then in terms of the everyday moments, I think about, you know, small things really do add up. And so we move a lot more than we used to. And so there's a growing percentage of people who live in America who say they don't know their neighbors very well. But that can make a big difference in terms of building positive relationships. So, physiologically, we know that having high quality, trusted relationships, and it doesn't have to be with a lot of people, it can be with a handful. That really helps you cognitively in terms of preventing decline. It's been shown to be associated with reduced odds of dementia. So, having people to talk to interact with. Mentally, when you have healthy social relationships, you tend to have, better mental health. So lower odds of anxiety, depression, and psychological stress. And physically, if you're engaged with people in real life relationships, you also tend to be a bit more active because you're more likely to go out to different kinds of events. And if you're actually leaving your house, it means you're also being physically active in some capacity. So there are a lot of different ways where having strong social connections makes a big difference. And I tell people it doesn't mean you have to live right next to your parents or live right next to your best friends. It simply means when you go to work, do you know the security guard's name? When someone new is at work, do you know who they are and introduce yourself? For the people on your street, do you know them and do they know you well enough that if you parked illegally somewhere, that someone can either text you or leave a note and say, hey, you're going to get towed. All of those things make a big difference in terms of having, healthy lives, across the board. So not just physically and mentally, but socially as well.
And I experience that a lot in Boston's Chinatown. I could be walking down the street to Tufts and I see folks from, Boston Chinatown Neighborhood Center or ACDC. So yeah, it really builds cohesion. And the Surgeon General named isolation as the number one public health crisis of our times. So I think there's a lot that folks can draw from your book, from a very like lived experience, but also hearing stories from many of the individuals that you highlighted in the book. One thing that towards the end of the book that you spoke about that I never heard of, even though I've been in public health for a long time, is blue zones, right? And this
Mhm.
is like a global, it's been in many countries and it's evidence-based. Can you talk more about that? What is blue zone? What is the evidence on it? Why do we think it works?
Yes. So there was a team of researchers led by Dan Buettner, and they had some funding from the National Geographic. I want to say maybe a few decades ago, maybe 20 years ago or so. They first started traveling to different parts of the world where people were routinely living into their 90s and 100s and older, and not only living that long, but also healthy lives. So these are 90 to 100-year-olds that are still walking, still engaging in community, still cooking, still, engaging in regular daily life. And he wanted to know what are the core things that help people live this long. And there are a couple of common themes that they noticed. So one is that many of these communities, healthy, fresh food was a natural part of life. So in places like Okinawa, Japan, or different parts of Greece and Italy, there are fresh farmers markets every day. And so it was part of the culture and part of life to pick up fresh produce. And, it doesn't have to be complex, but you make a simple meal that's made from fresh ingredients. And because it's locally grown and fresh and sustainable, people just naturally had access to whole, unprocessed foods. And the other part is that these cities, as with most of human civilization, they're built for walking. So it wasn't that people had dedicated 1 hour to, playing pickleball or going to the gym or doing a YouTube video. It's that movement was built into daily life. You have to walk or bike in order to get to work, to go grocery shopping, to drop your kids off at school, to go to different community events. And many of these communities were built before cars were invented. So walking and biking is the much more natural way to go about your daily life. So we were, built to move, and the largest muscles in our bodies are in our legs, and that's by design. And so even though people weren't going to the gym, physical activity was a regular part of their daily lives. And we know that physical activity is extremely protective and beneficial for a whole host of health outcomes. And then the last theme that they noticed were people really focused on family and community relationships. So you wouldn't see people sitting down to eat alone and read a book or be on their phone. They would be spending, 2 hours and having conversations with their coworkers, with their family, with their neighbors, and really enjoying the meal and also getting to know each other very well. And that makes a big difference because, you know, I talk about the strength of weak ties. So if we think about jobs that we get. Usually, your chances of getting that job are much higher if a person can vouch for you. And so, a person might say, I know of a position that just opened up, and they pass that along to you, and maybe it's not open to the general public yet. Or maybe thousands of people apply, but they know somebody on the search committee and someone you know, maybe not that well, but they know of you, puts in a good word. That's the strength of weak ties. And when we think about opportunities like jobs or homes, that makes a big difference in terms of shaping our health and our life trajectory. And so those community relationships make a big difference for how we navigate everyday life, from the big decisions to the small ones. And what really fascinated me was there was also a set of cities that wanted to be blue zones intervention sites. So, how do you take what works in blue zones and then what happens for a community that isn't healthy? So, maybe struggles with chronic disease and isn't walkable and doesn't have healthy food access. So Dan Buettner and his team also did a set of intervention sites where cities applied to be blue zones sites, and they wanted to transform their communities to be healthier. And there are many examples of success stories in this book. So there were blue zones intervention sites in the United States, in Texas, in Minnesota, in California, that struggled with many health issues, but by focusing on the three pillars, so changing something about the environment to make healthy behaviors the default, changing policy so that healthier decisions are codified into law, and then by focusing on community support, by building strong social cohesion. Many cities saw major gains in terms of life expectancy, reductions in obesity and diabetes and hypertension, reductions in smoking, increases in fresh fruit and vegetable consumption, and then also decreased healthcare costs. So it also has to be economically sustainable. And so one of the metrics that they tracked was, can this also decrease healthcare expenditures? And in some of the pilot cities, they found that to be exactly the case.
That's amazing. And there's a template now that cities can adopt and follow. And so I know we're reaching closer to the hour, and I really wanted to maybe two more questions related to the book and then a personal question. So your book is called The Collective Cure. And if everyone here who's watching could leave here tonight thinking about one small way that they could help create healthier communities, whether where they're from or communities that they work in, what would you hope that might be? What do you want them to take away from your book?
Yeah. Well, I would say um, one of the reasons why I focused on the title The Collective Cure is that when we think about cures, we really tend to think about individual treatments. But the story of public health and community health is that it's shared, and our health actually depends on one another, and not in a sentimental sense, but in a very practical sense. So the air we breathe, the food systems, the cost of food that we're exposed to, the water that we have, the different kinds of jobs we have, those all make a difference in terms of our health. And that's very much interdependent on many of these other kinds of structural issues and sectors. So that includes housing, education, certainly government, it includes media, technology. All of these sectors are very much interrelated into our day-to-day life, and as a result, our health. So the goal of the collective cure is inviting people to think, no matter what background you have, and even if you don't work in public health or healthcare, there's probably something that you do in your work or in your personal role as a parent or as a child or a community member, that there are active, concrete things you can do to create healthier communities. And so some of it might be showing up as a neighbor and, for example, offering rides to people to go to church. If there's a new parent in your community, offering to drop off a meal. Those are all tangible ways that people can help create healthier communities and foster that trust and that tangible support. And then on a professional level, if you're working as a manager or in any kind of company, one of the biggest drivers of health is how work is designed. And so if there's opportunities for you to think about how can I help create more work-life balance for employees, or how can I bring that up to the conversation if you're not in a managerial role? How can I consider that so that we're, yes, we want employees to be, excellent in carrying out the mission, but they can only do that if they can show up as healthy individuals. And so if you have sick employees, that doesn't, that is also a detriment to the health of the company. And so there's a vested interest for people who are leading organizations to really think about how can the work environment shape health, and how can I, as a manager or as a decision maker, think through the different ways I can enhance that for the employees here.
That's a great reminder that whatever hat you wear, we all have a role to play, right, to make our community safer and a better place to live. And so one final thought, and it'll be a two-part question related, is that, in how do you keep going? It's a lot. It's a lot. And what has been a good advice that you have received to help keep you going, to help you stay motivated in this work? And what advice would you give perhaps to other younger generations who are interested in public health, especially in this current federal climate?
Mhm.
So what is one piece of advice that you were given that has really helped sustain you and impacted your life? And what advice would you give others?
Ooh, that's a great one. Well, I think back to what keeps me going, and I will say that every single time I've made some kind of advancement in my career, it's because I worked with or spoke with somebody who was completely outside of my field. So, I'm in public health and academia, but when I met with people in journalism, when I met with people in tech, when I met with people in industry and consulting, when I met with policymakers, every step of the way, I learned something new about how they were doing work that was aligned with public health, and how I could also think about new ways I could collaborate with them. And that also helped me learn how to communicate the work of public health in ways that resonate with different audiences. So, what keeps me going is that uh, no matter who I meet, there's always people who are public health champions, even if they haven't been trained in public health or they don't have that in their job title. And there's three other women in this book that I interviewed, and none of them have public health training, but all of them are helping their families or communities in some way. And so one example is Dorothy Oliver. So she is a semi-retired African American woman in rural Alabama. So their community, there's no broadband, there's no grocery store, there's no hospital or healthcare center. And she knew when COVID hit that they would probably bear the brunt of it because there was no infrastructure to help. And so she really focused on getting the community vaccinated. And there is also growing vaccine hesitancy and skepticism. Um, Alongside that, there's also decreased access. So with Panola, nobody was scheduled to go out to Panola to give the community residents vaccines. And she needed at least 40 people to sign up before a mobile vaccine clinic would come out. And she spent her own time and her own resources knocking on every single person's door. And because she was such a trusted community member and leader, and because she had developed strong relationships, um, pretty much, 97% of that community got vaccinated against COVID in 2021, whereas the state level for Alabama that year was 48%. And so, she did what Dr. Anthony Fauci could not do, or what I could do. We could have followed her exact same protocol and gone door to door, but we couldn't have achieved that result. And so, what keeps me going is that I think people bring different kinds of gifts and experiences and expertise, and we need every single one of them. It's not just the people who are studying it or writing about it, or are scientists, or who wear public health hats. It really that we need people at all levels and on the ground to help us do this work. So, advice to the next generation and to my daughters. Um, I would say, remember that your greatest strength might be the very thing that you thought made yourself different. So when I first started writing this book, I was a little bit hesitant to, write about my personal experiences because there's a very, a personal vulnerability to sharing something so publicly. But when I would speak about it with my classes, with different audiences, before I actually wrote the book down, I noticed that people really gravitated towards my personal story. As a medical student, as a working mom, people can really resonate with how these different concepts show up in everyday life. And so I used to think, I'm the very odd person who was Asian and in Metco. And, at the time, I had my kids a little earlier on than the rest of my peers. So it felt very different to be a working mom with two small kids and a husband in residency. So there were a lot of firsts, but those experiences helped me do my research better because it helped me ask better questions. It helped me interpret the data differently and give a human voice and a story to that lens. And so the last thing I'll end with is that you get to determine and live out your definition of success. And you have the freedom to also change what that looks like in every chapter of life. Think about what success means to you because it doesn't have to be that cookie cutter corporate definition. It could simply mean, freedom or flexibility or peace.
That's so beautiful. And I don't know if your daughters are probably not watching, but when they get older, they'll watch this, right? And it speaks to me too, even though in career, I think being hopeful and staying true to who you are, I think at the end of the day, that's what we all need. And so that's a great place to end, and I will pass it to Ryan to lead us in Q&A. This has been such a privilege, Monica, to be able to learn more about you and learn about the work that you're doing through your book.
Thank you, MyDzung. Those were great questions.
Thank you both, and thank you to everyone who submitted questions for the Q&A portion of our program. I will start with the first question here. Someone had asked, with funding and program cuts, what are some innovative models for health services delivery that you see working?
That's a very, real question because there's funding cuts everywhere and organizations are being asked to do more with less. I would say one is investing in community partnerships and relationships. And that doesn't have to take a whole lot of funding because investing in relationships means inviting people to the table, listening with an open mind, and sustaining that over time. And so, with community partnerships, for example, with healthcare systems or different kinds of companies, there are great examples where healthcare organizations have partnered with local community residents. And so they have a community advisory board. There's relationships and ongoing conversation, and not just when a crisis hits, but rather it's really built into their everyday communication. And when people feel that they're listened to and really invested in, that can go a long way in terms of helping implement initiatives once they've rolled out. So, an example would be let's say a healthcare system has a new colon cancer screening initiative. And if they already have trusted relationships with community health ambassadors, that's going to make a big difference in terms of getting people to actually sign up, which is also good for the healthcare system in terms of increasing, patient volume and flow. Because if you have this new initiative but nobody's signing up, then we haven't achieved benefits in all the areas that we want. And so I would say, sustaining that relationship over time, because when the community feels invited and trusted in, they'll continue to show up even if funding runs out. And so we see that with champions like Dorothy Oliver, who will volunteer their time because they care deeply about the community and they'll show up if other organizations also show they have the same kinds of priorities. The other models that I've seen work really well are cross-sector collaborations. So organizations that are very strategic about We might not be able to solve everything, but what are the one or two key social drivers in our community that's making a big difference in terms of health or the overall health of the community? So one example in Detroit is transportation, because that's a city that was primarily built with the auto industry as the economy. So the train system, the bus system is not well invested in. And one of the biggest barriers for people getting to the hospital was because they didn't have reliable transportation and they didn't have a car. And so different healthcare systems like Corewell Health really invested in public transportation, or they partnered with private companies like Uber. So there's Uber Health, so that patients can really get the care and address the key driver or the key barrier, which is transportation. Other healthcare organizations have really focused on food security. So Geisinger Healthcare System created a fresh food pantry because they had patients who had diabetes and who were told, here's how you need to eat healthier, but they didn't have access or they couldn't afford it. So they partnered and created a fresh food pharmacy, and patients are able to get at least 10 free meals a week, along with diabetes support materials and an app. And when they partnered with other organizations that can bring those strengths to the table in terms of different services, that's where we see a lot more innovation and a lot more impact happen.
All right, we have another question here. I think building off a little bit of that last question, what are some successful strategies that you might suggest to build trust between a local healthcare system and the surrounding communities?
So every community is probably in a different place and it changes over time. So I tend to want to know where people are in terms of where they're starting. So are we starting from a place with strong connection? Are we starting from a place where there hasn't been much relationship? Are we starting from a place where there's actually been some negative history? And all of those starting places require different kinds of strategies. Um, One way that leaders can help address this is really by, first genuinely showing up to listen. So before any, um, major decisions are made, have you actually gone out and met with people at different levels in different sectors of the community? So you have a 360 understanding of how different entities are maybe experiencing the similar problem or similar challenges. And the other part is consistent communication. And especially in leadership positions or during times of crisis, um, over communication is always better than under communication. And if you think you're over communicating, you're probably communicating just about enough. Where things can go south is when people perceive that decisions aren't transparent or they haven't been looped in. And people understand that, there's trade-offs being made, but if they haven't understood the context and they haven't been communicated to and with in a way that's respectful and acknowledges their concerns, then that's where relationships might experience more barriers. So it starts with listening, and it also starts with valuing community expertise. So whenever possible, I focus on also financially compensating community members for their expertise because, um, you know, we know that funds are maybe low across the board, but that's also a different kind of support that community members need. And if they're giving their time and they're giving their relationships and they're giving their lived experience, that's really critical to also helping initiatives take off and become sustained.
And Ryan, if I could also add to that, I think echoing what Monica you shared is like really, it's really about relationship building, right? Understanding the history of the institutional community partnership, especially if you're a newcomer faculty or student in the area. And I think that's one example of the work that within Tufts and our ADAPT coalition we tried to do like ADAPT was formed in 2011 in response to the presence of Tufts Medical Center in Boston's Chinatown, right? About like a third of the footprint. And so I think over time in relationship building, kind of understanding the harms that have been put into Boston Chinatown in a very residential community through urban planning, urban renewal, that I think through ADAPT, really going door to door, faculty partners with community-based organizations in Boston Chinatown, as well as those serving in the greater Boston area, really understanding what is the community needs, right? And building that relationship over time. And so I think at the end of the day, as federal administration come and go, it's those relationships that we've built that can sustain, right? And that comes together, especially during the pandemic or now. So I think, yeah, I really want to echo that I think there's really power in the work. And at the end of the day, there's more of us, the community members, and more strengths that we can build on each other.
Thank you. And we knew it was coming. We have an AI question. This question is, do you think artificial intelligence will play a net positive or a net negative role in public health moving forward, taking into account both benefits and drawbacks, such as data center water usage?
Yes. Well, like most answers to complex questions, I think it's nuanced. I think I'm cautiously optimistic, but there's so many things that are unfolding, and I think it's really critical that we're intentional and strategic about if we decide to use AI, how and what is it used for? Because it's not net positive, it's not neutral environmentally, and it's not neutral morally either. And I hear people talk about AI as a tool, and I encourage them to remember, AI is also an agent. It's not like social media because, a tool is something that humans can use for their purpose. But some AI technologies can make decisions on their own. And if we haven't built in those guardrails, that could lead to very disastrous outcomes because AI operates based on the data it's given. And we know that data sets can be biased, they can have incomplete information, and they can also have inaccurate information. So AI doesn't necessarily see what the world looks like if you actually go and do a representative sample with an expert panel of community members and scientists and policymakers. A very representative group of humans might actually have a different view than what AI has based on what it's stored quantitatively on the World Web. I would say ways AI can help are, improving access in terms of rural communities and helping map out geospatially where different social and structural determinants might overlap. So that could help in certain ways. But there's also risks in terms of, continuing to spread misinformation and also the very real environmental costs on water supplies. So there are a lot of communities that are working actively again with signing petitions against opening up new data centers in their community. And I think that's something that we need to be very mindful of because with as accessible as it is, it's easy to not think about what that impact is in terms of if I ask it to help me redraft an email, that actually equates to one water bottle, and that can really add up over time if somebody's using an AI tool multiple times a day. So I think public health is not just about immediate health outcomes, but it's also about planetary health and sustainability. And are we using it intentionally and ethically in accordance with the values that we have, both in the short term and the long term?
I think that is a good one to end on. So I believe, Monica, you had sort of a closing reflection for us as we end our program this evening. So I will turn it over to you and thank you everyone for joining us this evening.
Great. Well, I want to close off with the meaning of the word community, and it comes from the idea of shared gifts. And that's what I think, this book and this field really is about, is not one individual or one sector like healthcare or public health trying to solve everything, but each person coming to the table with a gift they can give, whether that's being a supportive, partner or parent, or having an innovative idea about how we could use AI to address some of the climate change issues or water supply issues. And so the book is really about relationships and our shared gifts, and whether that's relationships between individuals or between individuals and institutions. When we come together and we each own a slice of the pie, I think that's when we'll see the shared and collective impact of public health.
Thank you so much, Monica. That's beautiful.
Great. Thank you both for your time. And thank you everyone for joining us on this call. Like I said, this was recorded and we will post it out on our YouTube channel within the next few weeks. And we hope to catch you at the next event. Thank you so much and have a great evening.
Thank you, everyone. Go Jumbos.